Hi everyone, how are you? This is Dr. Kim. Today I want to go over a biopsy-proven ameloblastoma. You're right, this lesion has been biopsied and is proven to be ameloblastoma, and I would like to go over its radiographic features. The patient is 62-year-old patient, and from this axial view you can tell that there is a radiolucent lesion in the posterior right mandible. So let me go ahead and bring my crosshair over to that area, and you can see that it's occupying most of that mandibular ridge. So now what I'm going to do is I'm going to rotate the volume and look at this area both from the sagittal as well as the coronal view. So why don't we start out with the sagittal view? In this case, the patient has number 30 and 31, and 32 is missing. You can see that the lesion is very well defined and has a corticated border from as far as we can see. The inferior border doesn't appear to be well corticated, and part of that reason is, well, it's thinly corticated. I hope it shows up on the video. That's because it's right now right up against the mandibular canal or inferior alveolar canal, which has been displaced, as you can see, inferiorly. Not only it's been displaced, if you compare the dimension of the canal that's located posterior to the lesion, it was a lot wider and bigger, and now it's been constricted quite a bit. What about its behavior on the distal root? I think it's a little bit difficult to note. It would be But the distal root apex does appear ever so slightly flattened, and we should definitely consider the possibility of root resorption here. Another feature that we can see is that as we go over to this area, alveolar crest has been disrupted. Now let's scroll through the volume in the AP dimension and study the relationship of the lesion to the mandibular canal. So let me go to the posterior area and move anteriorly. So pay close attention to this canal. So the now canal is coursing anteriorly. So for now I'm going to move the crosshair away, and as we move anteriorly, there you go. There's a lesion. There's a canal, and here's the beginning of the lesion. So we're starting to see the lesion. And can you follow the canal? We lose part of the cortication, right? But the canal is located here. It's embedded pretty much into the inferior cortex of the mandible. And there we are starting to re-establish the cortication of the canal. Once again, there you go. There's a loss of the cortication. And here's the canal again. As you already saw previously, it surprised me that there's not a lot of expansion in this case. In this particular example, it's spreading along the marrow space of the alveolar process. We have yet to see displacement, perhaps minor root resorption of the distal root, but again, besides the thinning of the adjacent cortical plates, we're not seeing a lot of expansion, which to me was one of the surprising features of this ameloblastoma. So now we've already looked at the cross-sectional view from the corrected coronal section that I showed you earlier, but let's go ahead and look at the panoramic view that almost all of us are very familiar with. Again, keep in mind the patient is in 60s, and right over here there's a lesion, and you can see the inferior displacement of canal. Had I not known the final diagnosis, I would have definitely, I think, included odontogenic keratocyst, OKC, in my differential diagnosis for a lot of just similar benign behaviors that I see, but most importantly, when I don't see a lot of expansion in this case, I have a tendency to include odontogenic keratocyst. But in this case, it just happened to be ameloblastoma. So again, we don't always see ameloblastoma very frequently, and I hope if you haven't seen ameloblastoma before, here's an example. I don't exactly know whether this loss of alveolar crest has been due to biopsy. I would presume that the biopsy was done only after the scan was taken, but this is a feature that appeared to me somewhat aggressive feature that's consistent with ameloblastoma. Anyway, thank you very much for your attention, and hope you found this video helpful. Please subscribe, and I'll see you in the next video. Take care.